There we go. Very good timing. So at this point, I will hand over to Molly, who will be directing the conversation initially between Emily and Naomi. So thank you, Molly.
Thanks, Catherine. I too would also like to start by acknowledging the Burungaron people of the Kulin Nations as the traditional owners of the land where I'm working from today, and pay respect to their elders past and present. I'd like to extend my thanks for everyone for attending this session today. As well, special thanks to Naomi, Natalie, and Emily. I'm sure that this is going to be a really great discussion, and it is actually the part 2 of our In Conversation series on prenatal testing, where we invite people to discuss these topics whose voices are really important, but are often not given the platform which they need. So I'd like to start off the session by first asking the panel members about themselves. So I wanted to start with you, Emily. Could you tell us a little bit more about yourself? For example, what are some of the things you do, and what are your greatest achievements?
Okay, I am a married woman. I am a married woman. I recently celebrated my 10th wedding anniversary with my husband, Michael. I have 3 sisters, and I have 6 nieces and 1 nephew. One of them is on the way. I have been working as a health ambassador for a while. My husband and I live independently in a small unit.
Thank you so much, Emily. Wow, 10 years of marriage. That's amazing. Now, Naomi, could you please tell us a little bit more about yourself?
Good morning, and thank you for inviting me. I'm a health ambassador for Down Syndrome Australia and DSWA. I'm also a employment ambassador for DSWA. I am an author, advocate, performer, and a public speaker. I have written 3 children's storybooks. After the publication of my first book, I've toured small schools and remote communities to share my stories with children and conducted literacy activities with them. I am passionate about children's literacy because reading and writing has opened up the world for me. And it's good to be a role model and show them that everything is possible. And I have 3 sisters and 10 nieces and nephews.
Wow, thank you, Naomi. You sound very busy.
Yes,
you do lots of things.
Yes, I am. I'm just enjoying my what I do for work, and when I'm not working, I always love spending time with my family, even though they're not there.
It's great. Now, today we are joined by a very diverse audience that includes people who work in healthcare. So these people are often talking to parents about the option of prenatal testing. So I wanted to ask, Emily, if you'd like to start, what are 3 things that you think parents need to know before having prenatal testing?
I think, which one?
Just whilst Em's finding that, I just wanted to let everyone know that we gave Em and Naomi the questions beforehand so that they could remember what they were going to say. So that's why Em's reading them.
Sorry.
Go, Em, go.
What are the things about what they would do? They find out the results either way. if a test picks up that they might be something wrong with the baby, it does not mean that the baby cannot grow up or have a happy, full life. When parents have a test, it is important that they speak to people that they trust and support. It is important for parents to know that doctors and nurses don't always get it right. Knew that having a baby with a Down syndrome is not the end. Advice to sorry about that.
Well, good, Em. Well done.
Yeah, that was really good. Thank you. Naomi, what are 3 things that you think parents need to know before having prenatal testing?
Well, they need to think about why they want the test. Will you terminate the pregnancy, or do you want to find out more information about Down syndrome so you are prepared when the baby is born? Our parents need all the information and support that is available to help them to make the right decision for them and their family. What is it about Down syndrome that you are afraid of? Focus on the positive aspects of Down syndrome before you talk about the negatives. Thank you.
Thank you, Naomi. That was really great. I agree that having more resources is very important, and especially focusing on those positive aspects that you mentioned. Also joining us today are a lot of researchers who work in the field of prenatal testing. So Emily, if you'd like to start, do you think researchers working on prenatal testing should include people with Down syndrome in their research team?
Okay. That one?
Yes.
Yeah. Yes. Why should Richards involve people with Down syndrome in their research? I didn't have to say that. Richards sometimes may need to be reminded that people with Down syndrome can have a rich and renewing life.
Thank you. Naomi, do you think that researchers who are working on prenatal testing should include people with Down syndrome in their research team, and why?
Yes, definitely. If they are researching about Down syndrome, then the best people to be involved are the people with lived experience of Down syndrome. Their input is invaluable.
Yeah, absolutely. Now, I know a focus of the Health Ambassador program is on promoting inclusive communication. So how do you think people should speak about prenatal testing? Emily, would you like to start?
Mm-hmm.
Bad timing was taking a sip of your drink there.
Which one? This one?
How do you think people should speak about prenatal testing?
Okay. When talking about Down syndrome, give more information to families. Give information about the Down syndrome can do. They can do anything. It is just in different ways. Like I can drive, but I can catch a taxi, and I have learnt how to use public transport so I can get where I want to go.
Great, thank you. Naomi, how do you think people should speak about prenatal testing?
When doctors are informing parents, I don't like the word risk because it signifies danger. The word chance represents a gamble. The word possibility is less threatening and more friendly and positive way of explaining Down syndrome. People with Down syndrome are doing amazing things and can lead a happy, independent lives.
Thank you, Naomi. Yes, the choice of words that people use is really important. So I'm really glad that you brought that up. That concludes our formal question time. However, now I'd like to open it up for audience questions. If anyone has any questions for Emily or Naomi.
Which one?
I'll start with Catherine.
Emily and Naomi, thank you both ever so much for your contributions. I wanted to go back to the question that Molly asked right at the beginning and about what parents should know before they have prenatal testing. And Naomi, you made the point that when we have those conversations, we should focus more on the positive aspects of Down syndrome before we talk about the negative aspects. So I just wanted to ask you to say a little bit more about that. And what do you think parents should know about Down syndrome before they have the test or at any point really? And how do they go about getting that information? What would be the best way for them to get that information? Sorry, that's a long question. Emily or Naomi to answer would be fine.
I think I know this one. They might need to go to the doctors to find out a bit more information about babies with the Down syndrome.
Yeah, thank you.
And I'll just break it down to two separate questions there.
Thanks, Natalie.
So and Naomi. So I suppose the first question is, what do you think parents should be told, or what information do you think that they should be told when they're having prenatal testing about people with Down syndrome? What would you like them to know about your life?
Well, since my parents raised me, I'm not really quite sure about the testing, but they did have a change of pattern, and that's how you become as a Down syndrome, and that is a person, well, we are.
So it wasn't the pattern that your parents really thought that they'd be going on, but that look who they got instead.
Yeah, because Mom treats me like I'm special. I'm a needy baby because I got a great sense of humor. I do make people laugh, so that's what I do.
Yeah,
that's right. That's exactly right. Naomi?
Well, it can lead a good, happy lives as easily as possible, and the best people to speak to is talk to other parents with Down syndrome.
And I'll just add my 2 cents worth and say, and a local Down syndrome association, so whatever state and territory anyone is in, they can connect anyone with parents and or information.
Thank you, Natalie,
you.
Emily, and Naomi. Juliana.
Oh, hi there, Naomi and Emily. Thanks for your talk. I'm Juliana and I work with Catherine and Molly. I just was wondering, what do you think of this idea? What would it be like if we had people with Down syndrome working with, say, genetic counsellors or doctors, people who provide information to families or couples that are going to have prenatal testing? So it seems to me that some people have not met someone with Down syndrome and have not had the opportunities that I'm having today speaking with you. So would it be good to include people with different outlooks and people with Down syndrome on the team of people that talk to parents? So there's a rather long comment, sorry.
It's all right. But I do have one.
Well, firstly, Em, just what would you think about that idea? Would you think that'd be a good idea, or if people with Down syndrome worked with the doctors and the team?
Well, I do hope they can work as a team and try to get to know the person who has a Down syndrome.
Yeah.
Naomi?
I say yes, it's a great idea as a part of the team. It has a part of a team. And people will come together as one.
Yeah, great. Thank you. I might go to Andrea now.
Thank you very much, Naomi and Emily. I'll put that there. Thank you very much, Naomi and Emily. Naomi, in your presentation, you said that parents fear people with Down syndrome. What do you think are the things that parents fear?
I used to work in a childcare once, and I saw this baby, and I just noticed, I saw the eyes like mine are. His parents would not accept the child not to have a Down syndrome, and they got scared of it and they don't like it. So I got a bit offensive, and having a baby with a Down syndrome, it's not that bad, it's normal.
Thank you, Emily. Naomi?
The fear of unknown, lots of misinformation about people with Down syndrome.
Thank you very much.
Yeah, absolutely. And that comes back to the points that you were making about providing more information and looking at those positive sides as well, or more so. Courtney.
Hello, I'm Courtney. I'm just doing my PhD with Catherine at Monash. I was really interested in what Naomi said about the language that's being used in prenatal settings. And I was wondering, Naomi, if you could maybe talk a little bit more about that, and maybe talk a little bit about like the difference between talking about risk versus talking about chance. I can't remember if there was another one that you said as well, but I would be very interested to know a bit more about that.
I'm sorry, what's the question?
So Em, when Naomi spoke before, she spoke about doctors using words like telling parents that they might have a risk of having a child with Down syndrome rather than a possibility. And so just about the words that people use when talking about people with Down syndrome sometimes have not such a positive or make people feel a bit negative about it. And so Courtney just wants Naomi just to have a little bit more of a say about that.
So these words that I mentioned actually put off people with Down syndrome of having a child. with Down syndrome. So it's already a negative thing. So the doctors need to be more careful what they say.
Okay, great. Thank you.
Liz?
Thank you, Emily and Naomi. It's fantastic to hear about the full lives that you're living. Naomi, I'm a bit of a frustrated author myself. I wanted to ask you, how did you get into writing books?
I don't really understand.
So Em, it's just a question for Naomi, just about her books that she writes, and what made her start writing books in the first place.
Okay.
Sorry.
Yeah, so I always loved writing. I always love writing and also love chickens as well. But the way I started is just the ideas came sitting on the patio one day, and one of my chickens keeps darting in and out.
Mm-hmm.
And Mum said, "What will the chicken lose?" I said, "Her eggs, of course." and that was my first book. So so that's when my first book came in. And one of my sisters, Paula, she asked of handing in my story to her because she knows someone who can illustrate my book.
Oh, great.
So she sent that away and then came back and saying, "Here you are, Naomi, you're now an author." So I was standing there with my mouth wide open when she gave me the book, had a surprise Christmas present for me.
Yeah.
And then from there, I decided to publish it to the world.
Fantastic. Thank you so much. What a wonderful story.
Thank you.
Lucinda?
Thank you. Sorry, you'll have to excuse me. I'm home with a cold, not COVID this time, but just a cold. But I'm a genetic counsellor. So some of what you talked about before really sort of resonated with me. And I'm one of those people who meets with parents and prospective parents to talk about these results from prenatal testing. And some parents ask me, what's it like to have a child with Down syndrome? And what sort of supports would I need to have a child with Down syndrome? So my question for you, Naomi and Emily, is if you would be okay sharing with us the important people in your life who've helped, maybe when you've had a challenge or something which has been difficult, like we all have. It's good to know so that I can help parents understand who they might need in their community around them.
Naomi?
Well, I have something. I have a very supportive and loving family, and they always help me a lot.
That's great. Emily, do you have people that help you or support you when you need?
Yes, I have my mom. My parents is divorced, and mom is really nice person to talk to about it, and she's really good with people with Down syndrome. I have a sister, and she works in the office in North Melbourne, and she helps me out a lot. So she's been teaching me how to do other things to talk about Down syndrome.
And Em, who's sitting right next to you?
That could be some my spokesperson, Kerry.
So you have Kerry that comes and support, and Michael has, who does Michael have?
Nathan.
Yeah. So through the NDIS, you've got lots of supports, haven't you?
Yes, I have.
Thank you, Emily. Peter?
Hi, thank you. That leads quite nicely into my question. I wanted to ask, if researchers or teams, organizations would love to invite people with Down syndrome to come and help us get it right, help us get the language we use and all of our information right. If we invite people to come and help us do that, what kind of support do we need to provide to make sure that it's a safe and happy project for you to be involved in as well?
Naomi?
Well, I'll give you one of my tips. I say paperwork in easy read, so people can understand language, and also give more time to complete tasks.
Natalie?
So I'm going to have my 2 cents worth there, but I'm going to just remind Naomi of a couple of things here. So Naomi sits on Department of Health Government advisory councils as a contributing member of that team. And I think the key part is that anyone with an intellectual disability or disability as a whole is a contributing member. And so, as Naomi's just said, that the papers come out in easy read, don't they, Naomi?
Yes, they do.
And you get a little bit longer. So the agenda and everything comes out a little bit earlier because it just needs a little bit more time. And quite often, so another committee that one of the other health ambassadors that we employ sits on, which is a research out of the University of Queensland. We have a pre-meeting before the meeting to go through the agenda, to go through the meeting notes, to discuss what's going to be discussed and making sure that everyone is understands what's going on, so that they can be contributing member of the committees.
Emily?
Yeah, I went to the a government as well down in Canberra when I was doing my speech. I went to speak to Bill Shorten.
Wow.
And he was a doctor, so I've been talking to him what things he does.
That's great.
You did a great job, didn't you, Em?
Yeah, I really enjoyed it.
Catherine?
Thank you, Emily. I've been listening to your story, and it, you know, you live an incredibly full, independent life, doing amazing things, talking to Bill Shorten and so on. And I wonder, I mean, thinking back to what parents need to know, do you think that people are still surprised that you lead such a full and independent life? I mean, do people still have a sense of Down syndrome as very limiting? Is that the kind of stereotype that you still see sometimes?
I do sometimes. I have a husband named Michael. He also has got a Down syndrome, but he can feel his disability. I can't feel mine.
Right.
But his dyslexia, and he can't really read, so I have to help him to how to read, and sometimes he doesn't really understand. He doesn't read, but he prefers pictures. Actually, help to people with Down syndrome.
Can I ask one more question?
Sure.
So this is a question both for Naomi and Emily. I'll give a long introduction first, and then I'll ask my question. So Molly and I are currently doing a research project on non-invasive prenatal testing. And I regret to say that we do not have someone with Down syndrome involved in our team, which is something I should have thought of earlier. Sorry about that. But listening to your responses earlier about the kinds of things that people should be doing to make it easier, or to involve people with Down syndrome, but also other people, to help other people understand Down syndrome more. We're very interested in the kinds of things that parents are told before they have testing. And I'm curious to think about how some of those things, like giving a little bit of time, a bit more time, or easy reading and so on, can actually be really helpful even in that kind of space before parents have testing. And I just wanted to get to see if you had some comments about what we might do in that kind of that moment before people have tests to improve that kind of context, I suppose. That's a long question, Natalie. You might want to pick out the important bit.
Yeah, I'm actually sort of not sure what you want to know either.
Fair enough. I'm thinking about the kinds of materials that people are given before they have a prenatal test, which don't necessarily provide very helpful information, I suppose. They might be written in complicated language, or just don't give a very full picture of things. And I wonder, I guess there's a question about whether people with Down syndrome could be involved in that process of actually providing or developing information about prenatal testing, but also what that kind of material should really look like, what information should be included.
Yeah, so I suppose Em and Naomi, like, do you think that the information that's given to parents before they think about having a baby should include information and stories and pictures about children with Down syndrome and what they can and can't do, and what your life has been like?
Well, my childhood was really good and I really enjoyed it. My mom used to read me a book when I was a baby, when I was going to bed.
And do you think that would be good for parents that are thinking about having children to know, Em?
Yes.
And do you think maybe pictures might help, or stories?
Well, I know I can read, but sometimes I do like pictures.
And do you think parents might like that as well?
Yes.
And Naomi's all ready to go, I can see.
Yes, I do, Natalie. And I say yes. I say yes, that'd be helpful. Well, the best way is to contact DSA or info available.
Yeah.
Before they have testing.
That's the important thing, because I think many people might do it after testing, but not beforehand. People don't necessarily even think about what testing is for beforehand.
Thank you. Emily, do you want to say one more thing?
So just one thing. I don't know if my mum did testing before, but yeah, that's way different. Since I was born normal.
Yeah, great. Thanks, Emily.
Naomi, did you want to make another comment?
Yeah, I do. I just want to add on. My mum didn't go through it either. And she didn't do any testing. So she didn't really care.
Thank you. Thank you, Catherine. Juliana?
I just wanted to find out a bit more about what is offered before prenatal testing. Maybe Lucinda has some info on this. Like, is there written information available written by people with Down syndrome? Or maybe you could have a couple of copies of Naomi's books available to prospective testers. I'm not sure what already happens. Does anyone know?
I'm happy to speak, but if someone else wants to speak as well, they can go first.
Down Syndrome Australia does have information. Absolutely. It's on our website and accessible quite easily for anyone that is looking. It's very difficult to get that information sitting in obstetrician and gynecologists' rooms, but it's definitely on the website.
Sorry, Natalie, are you saying it's difficult for you to get it in there, or it's difficult for patients to access? Or?
It's not difficult for patients to access. It's difficult for obstetricians and gynecologists to actually physically have anything in their room because there is their preconceived ideas that it is a negative.
Oh,
I think also the difficulty is that a lot of people don't have a conversation about it before testing. So what Catherine was talking about before is that, you know, from my experience and my understanding is that most pregnant people who go through with this sort of testing don't even have a conversation that I would call a conversation about the test. So it's one thing to, you know, the one challenge is, you know, having access to information, but the other challenge is just knowing that you might need some information. And knowing that you might need some information means that you need to have had a conversation with the person who's ordered the test for you. And because that conversation doesn't often happen, and that this is often, to be honest, Juliana, it's often just offered as part of routine testing if someone is pregnant. And so there's not necessarily that pause and discussion about even what the test is to even allow someone to think, well, what information do I want and what information could I go and seek before doing it?
And I'll just add one thing to Lucinda there, and Lucinda used the word testing, and it's actually quite often screening is done before the actual testing, and people don't understand that it is a screen rather than a definitive test. And Lucinda's 110% right. People, women, people having babies go in and the doctor writes them a script. You go and do this, and this is part of being pregnant. And it's not a conversation. Yeah.
Yes, that kind of move to making it a routine part of pregnancy is something that's very worrying, because people are not looking for information beforehand. They're not finding out the stories and about the lives of people with Down syndrome beforehand. They, as they should be. I think it's the decision always comes after the screening, if you like, which is a problem.
Does anyone else have a final? Emily, would you like to say something?
Yeah, I do like to understand, why does that be a problem?
That's a good question, Emily. I think people should, ideally, I think people would make the decision and think about this before they have prenatal testing. So then they're a bit more, they understand some of the possible implications of the test, and also are a bit more prepared in some ways to think about the positive aspects of Down syndrome without getting to the point of being afraid, like Naomi suggested. So instead of hearing the test results as bad news, they are more prepared for whatever comes out of that test. That's why I think it would be better to have it earlier.
Yeah. And for me also, Emily, one of the things that I think is important is, I'm not sure if it's yourself or Naomi who said this at the beginning about
but that'd be me, actually.
saying to people, what would they do with that result? And what would they do if they found out that there was a possibility of the baby having Down syndrome. And for me, as a genetic counsellor, I would like to think that people give consideration to that question that you just asked or Naomi suggested before even having any screening or testing. So they can talk with people who are important in their lives. If they have a partner, they can talk to their partner about that, what that might be like. They can talk to their supportive people so they can make a decision which is right for them before even finding out any of this information. But that takes a lot of time, Emily, and people don't always have that time or are not given the time.
Yeah, my parents never had testing before because they haven't been, because since I was born, I was really quite different. Everything is different from me being pregnant with a Down syndrome baby. That's a blessing.
Yeah.
I think that might be a good place to stop. So I might pass back to Catherine, but if everyone could please join me in thanking Emily, Naomi, and Natalie for joining us today. It was a really great discussion. I'm so glad that you took the time out of your day to speak with us. So thank you so much.
Thanks.
Thank you for having us. I'll speak on behalf of Naomi, Em, and myself. Thank you so much for having us. It's very valuable to have people in the field considering this very important topic.